How to stop bleeding after wisdom tooth extraction. The third molars, often known as wisdom teeth, are removed through a dental operation called wisdom tooth extraction. These teeth generally cause issues since there isn't enough room in the jaw when they erupt in the late teens or early 20s. Extraction may be required for a number of reasons. Impacted wisdom teeth, which partially erupt through the gums but still cause pain, infection, gum disease, and tooth decay can cause a number of problems. Additionally, wisdom teeth may need to be removed in order to prepare for orthodontic treatment or to avoid potential problems in the future. It is essential to speak with a dentist or oral surgeon who will perform a thorough examination before having your wisdom teeth removed. For the purpose of determining the location, size, and the development of the wisdom teeth, this examination may involve the use of X-rays or other imaging techniques. The dentist will decide whether an extraction is required after conducting their examination. Please be aware that everything discussed in this video is unbiased, verified with facts, and approved by a licensed healthcare specialist before we proceed. Don't forget to subscribe to our channel and turn on the notification bell for more videos like this. In most cases, the actual extraction surgery is done as an outpatient. The area around the tooth is numbed with a local anesthetic, and in some circumstances, sedation or general anesthesia may be employed. In order to expose the tooth and bone, the dentist or oral surgeon will make a cut in the gum tissue. To make the tooth easier to extract, they might need to remove some bone or cut it into pieces. The region is thoroughly cleaned after the tooth is removed, and sutures may be used if necessary. Post-operative care guidelines are given, and gauze is applied to the extraction site to stop the bleeding. Swelling, soreness, and slight bleeding are all part of the recovery process after wisdom tooth removal. While the body is recuperating, painkillers can help control any discomfort or pain. Using an ice pack on the outside of the face for the first 24 hours can help minimize the swelling. It is essential to adhere to the post-operative recommendations given by the dentist, which may include dietary restrictions, oral hygiene routines, and prescription medications. A few days to a week are usually enough for the majority of people to fully recover, but it may take several weeks for the body to entirely heal. Even though they are uncommon, complications can occur, and these include dry sockets, infections, nerve damage, sinus issues for upper wisdom teeth, and injury to the jawbone or surrounding teeth. Following the post-operative care guidelines is crucial, as is calling the dentist right away if any worrisome signs such as intense pain, heavy bleeding, or swelling appear. Preventing excessive bleeding after wisdom tooth extraction is an important aspect of post-operative care. Here are some measures that can help minimize bleeding. Bite on gauze. After the tooth is removed, your dentist will cover the extraction site with a sterile gauze pad and give you the go-ahead to bite down firmly on it. The gauze helps keep the region clean and lowers the risk of infection by absorbing any remaining blood and saliva. A blood clot in the socket is more likely to form with the pressure created by biting down on the gauze. By serving as a barrier of defense, the blood clot prevents further bleeding and enables the wound to heal. To promote adequate clot formation, it is essential to apply steady pressure to the gauze for the advised amount of time, which is normally between 30 and an hour. Avoid disturbing the extraction site. After a tooth is extracted, a blood clot forms in the socket, which is an important step in the healing process. A dry socket, a disease that can cause excruciating pain and postpone healing, can be brought on by disrupting or dislodging the blood clot. Avoid any acts that can disturb the extraction site in order to stop this from happening. Don't use your tongue, fingers, or any other implements to touch your region. Don't chew too close to the extraction site while you're eating. In addition, refrain from smoking or sucking through a straw because the power of the suction may cause the clot to become loose and cause more time to bleed. Avoid vigorous rinsing or spitting. Spitting or rinsing firmly enough to break up the blood clot can prevent the bleeding from stopping or make it worse. It is advised to refrain from any strenuous spitting or rinsing for the first 24 hours following the extraction. As advised by your dentist, gently rinse your mouth with a salt water solution. Rinses with salt water can keep the region tidy without disrupting the clot. A half teaspoon of salt should be dissolved in 8 ounces of warm water to make a salt water solution. Small mouth sips should be taken softly swished around the mouth and then allowed to pass naturally through the mouth without spitting. Avoid strenuous physical activity. Exercise that requires a lot of physical effort can raise blood pressure and heart rate, which might cause more bleeding. Heavy lifting, vigorous exercise, and other physical endeavors that place an inordinate amount of stress on your body are all considered strenuous activities. For the first 24 to 48 hours following the extraction, it is recommended to stay away from such activities. During this time, the blood clot can form and settle, lowering the chance of bleeding. Thus, rest and restricting physical activity are advised. Take prescribed medications. For the purpose of controlling pain, preventing infection, and promoting healing following the extraction, your dentist may recommend medication. For these medicines, it's crucial to take them as directed in terms of dosage and schedule. Following the procedure, discomfort can be managed with an aid of painkillers like non-steroidal anti-inflammatory medicines or NSAIDs or prescription painkillers. When an infection is possible or necessary, antibiotics may be administered. The prevention of problems and the promotion of healthy healing, which in turn reduces bleeding, can be helped by taking the recommended medications as prescribed. Apply cold packs. You can lessen swelling in narrow blood vessels by placing an ice pack or cold compress close to the extraction site on the exterior of your face. Reduced bleeding may result from this blood vessel constriction. Apply an ice pack or a bag of ice to the injured area for brief periods of time, usually 10 to 15 minutes at a time, using a cold pack or a thin towel as a wrap. A warm-up period should be allowed in between applications. In order to lessen post-operative edema and bleeding, applying cold packs for the first 24 hours after the extraction can be especially helpful. Maintain good oral hygiene. Keeping your mouth clean is essential for preventing infection and accelerating healing, even though it's necessary to be gentle around the extraction site. Take care to brush and floss your teeth as directed by your dentist. Brushing the rest of your mouth as usual, but be sure to avoid the extraction site. Brush the teeth close to the extraction site with a toothbrush with soft bristles. You can rinse your mouth with an antibacterial mouthwash as well if your dentist advises it. As a result, the risk of problems and bleeding is reduced. Maintaining proper dental hygiene helps keep microorganisms at bay and aids the healing process. Avoid smoking and alcohol. The recovery time following tooth extraction can be negatively impacted by smoking and drinking. The production of blood clots and the speed of tissue repair can both be hampered by smoking and drinking. Infection risk and complications following surgery may also increase as a result. For at least 24 to 48 hours following the extraction, or as advised by your dentist, you should refrain from smoking and consuming alcohol. By giving up these bad behaviors, you can help your body heal and lessen the likelihood of issues like persistent bleeding. To sum up, wisdom teeth removal is a popular dental operation to remove the third molars, which frequently cause issues because there isn't enough room in the jaw for them. After comprehensive inspection and assessment by a dental specialist, the decision to extract is made. While the healing process could be uncomfortable at first, according to the dentist's instructions, and if required, getting expert assistance can assure a quick recovery. It's important to get in touch with your dentist or oral surgeon right away if bleeding continues or becomes excessive despite taking these preventive steps. They will be in a position to analyze the condition, identify the reason for the bleeding, and offer suitable suggestions or solutions. Your dentist might occasionally request that you visit for a checkup in order to make sure that the wound is healing properly and to treat any issues. To reduce any potential hazards related to bleeding after wisdom teeth extraction, prompt consultation with your dentist is crucial for a health recovery. If you enjoyed watching Vital Health TV and learned something from this video, help us make this video the record holder for likes on our channel. Your likes show support and help YouTube recognize the video's relevance, leading to wider distribution and an increased awareness. If you haven't subscribed to our channel yet, we invite you to do so and activate the notification bell to stay updated with our latest content. Additionally, please share this valuable knowledge video with your friends and family, spreading awareness and empowering others with important information. Together, we can make a difference and create a positive impact. You can also tweak things out. As always, we care about your health. Thanks for watching.